Hello, everybody. My name is Wong. Today, Sue and I will present the experience we try about how to develop relationship between community work, public health practitioner, and the subdivided residents in Hong Kong for their children living in the subdivided flat and their eyes health conditions, especially in from the background of COVID-19 pandemic in Hong Kong. The children cannot go to school, cannot go out. They need to stay at home the whole day, and their eyes cannot take a rest because they need to because they limited space and the subdivided flats. So this project experience is basically we want to try the social medical collaboration, which is between the community workers and the public health practitioners. What we find in our experience is very pilot attempt project in Hong Kong, because not many NGOs in Hong Kong want to consolidate their experience between the community workers and the public health practitioners. So we share the value with the public health practitioner that individual health is contributed by behavioral, environmental, and socio-economic factors. That is common area in two professions, so that we can work out a plan to intervene the eyes health among the children in the subdivided flats residents. So, and the other framework in our experience, we need to very emphasize between the communication between the stakeholders is the social determinants of health, which is the structural factors affecting people's health in the community. Eyes health is one of the health issues in the community. We also introduced the public health practitioners, the international standard of community development. It is very specific that we use this framework in our planning of the project. We would like to use this framework to decide where we start the project, and the endpoint and the goal is where in the framework. So in this project, we want to go through the learning for change, organize for change, and at the end, we would like to build up leaderships and infrastructures in the community that help improve children's eyes health in the community. And then social medical collaboration in this project, we say that it is not very a generic term of between the social workers and the medical professions. Social medical collaboration is just a shorthand indicating the collaboration between the community development workers and the public health practitioners. And then we will find that in our experience, is the ingredients of the social medical collaboration is we will use three aspects or three approaches to implement the project. The first one is community engagement. We'd like to go beyond just providing information to their children and their parents in the community. We'd like to help them to involve the whole campaign and collaborate between the community workers, and the public health practitioners, and then work out a plan to how to normalize a healthy lifestyle in their everyday lives. And also we would like to improve their critical health literacy, not only reading the health information. They would like to cultivate their ability to analyze, to judge which piece of information can really help them, and how to make good use of the information and to improve the children's eyes health in the subdivided residents. And then ultimately we would like them to associate their health condition and the structural factors which use the social determinants of health perspective. So this diagram is the consolidation of our experience between the collaboration between the community development and the public health. We found that we have overlapping area between two professionals, which is not emphasized in the Hong Kong context, because the Hong Kong context, community development is a social worker sector, and the public health is a medical sector. The collaboration is very mechanic collaborations. This time we would like to bring two professionals together and work out and then implement the project together. In the course of the implementation, we have a lot of communication, threats development, and common language sharing, and then we have common goal, and so on. So in the collaboration, we've focused on three approaches. The first one is community engagement, critical health literacy, and the social determinants of health. So Siu Wei will illustrate the details of the project, and then she will also indicate which moment is very important to strengthen the collaboration between the community development and public health intervention. So I'll pass the time to Siu Wei.
Okay, hello everybody. Vision for Future Eye Care Project is one on a medical social model to promote healthy vision of the children living in the subdivided flats. During the pandemic, we found that the children's visions were especially suffered due to long hours of online learning at home with poor lighting and the parents' lack of resources and knowledge on eye care protections. In Hong Kong, the subdivided flat is so tightly enclosed that you can see in the PowerPoint that it's very tidy. There's no place for the children to have a decent place for study. Instead, they need to watch the mobile or read the book on bed. When we have checked and measured the amount of light of their home by a device called light meter, most of them did not know their home is not bright enough. Children always read or do homework in dim light, which will cause permanent eye damage. We have redefined the problem of individual eye health need to a public health concern issue, which means we changed the remedial approach to a preventive approach. As mentioned before, both the crowded living area and insufficient indoor illumination are the social determinants of health of the children live in the not appropriate housing in Hong Kong. If we are not using proactive approach to deal with this eye health problem, it will be a heavy burden of government in future, especially for the medical cost. By employing social medical cooperation, we could achieve a greater impact as synergy. Indeed, the social medical cooperation is not a simple division of labor, that's which Vincent mentioned before, but it must have three critical stages to go through. At first, both social worker and healthcare professions are at the same, come from different professional training. So we need to build up trust and share the same value for proceeding further. In the eye health project, the different professionals share the same belief that we have a mission to raise the public health awareness by using the children's eye care as the entry point. We use the co-design questionnaire to engage the eye health professions, and it helps us to collect information for making accurate intervention. Synchronization is another critical stage for social medical collaboration, as it facilitates the inquiry of health literacy to both parents and children. Social workers act as the facilitator to allow the professional eye health knowledge to a layman level understanding. By providing the chance of healthcare professions to home visits the children who live in the inappropriate housing, they were in the context to know the limitation of participating eye health knowledge or removing the harmful factor in their house. After increasing the health literacy of children and parents, our projects have moved to another stage for community solution, in which it is the last stage of social medical collaboration. By making the individual problem to a collective concern issue, we formed the parents' most likely mother to form the eye health ambassador in their own community. They promote the health knowledge to other parents and provide extra light source to fix the environmental problem immediately to increase the indoor innovations. Both the parents and children asked for community solution to support the children. They tried to convene the local school to provide a room or place for the children to have a decent or suitable study place. From community intervention, we figure out community solution, which provide a leverage effect of handling this issue. As a result, it provides more synergy and alternative to this problem. This is the end of our presentation. Thank you.